I dare ask again, does diabetes really have to be discovered when it's already too late? Because right now in Kenya, thousands of people are walking around with diabetes and they have absolutely no idea. No pain, no warning signs, no symptoms, just silent damage. And it's happening every day. By the time most patients show up in the hospital, it's not just diabetes anymore. It's complications, kidney failure, vision loss, nerve damage, and the most alarming part, over half of people with diabetes don't even know they have it. This is not just a disease, it's a silent epidemic. My name is Regan. I'm a medical practitioner and a clinical researcher with a focus on diabetes, metabolic health, and emergency medicine. In my daily practice, I manage and follow up patients living with diabetes and other chronic conditions. So what I'm sharing with you now is not just theory, but real practical experience from the front line of patient care. So let me ask you again, does diabetes have to be a late discovery? Or can we learn to detect it before it turns into a life sentence? In this video, I'll walk you through the truth about this silent epidemic, why it's rising so fast, why so many remain undiagnosed, and most importantly, how you can stay ahead of it. If you're serious about understanding your health, preventing disease, and practicing smarter medicine, please hit the subscribe button now and join this community. Let's get into this incredibly powerful subject after the short introduction. The International Diabetes Federation reported the total global prevalence to be 537 million adults as of 2021. This number was supposed to rise to around 783 million by 2045. In 2024, diabetes caused a total of 3.4 million deaths around the world, and this represents one death in every 9 seconds. In Africa, over 24 million are affected. However, more than 50% of cases remain undiagnosed, and the number is projected to rise to over 55 million by 2045. In Kenya, our homeland, the Ministry of Health has estimated the prevalence to be around 3.3% as of today, and that is of the adult population. It includes 2.4% of the population with diabetes and 3.1% of the population with prediabetes. While the prevalence appears to be relatively low locally, this disease remains dangerously undiagnosed, especially in our country, and this is because more than 50% of the cases have not been determined. Most diagnosed individuals always present with complications, and most adults die of diabetes without ever knowing they had it. So why is there a rise of diabetes cases in Kenya? A close examination of the rise of diabetes in Kenya reveals one thing: it is not a random occurrence. It is a state escalated by a combination of lifestyle, environmental factors, and missed opportunities for diabetes mellitus prevention. Among the factors that have contributed to the rise include the following. The first is urbanization. Physical inactivity is more closely associated with moving to urban areas due to sedentary jobs and reduced physical activity. Over time, this lifestyle becomes a perfect recipe for weight gain, and that contributes to metabolic imbalance. The second factor here is nutrition. Dietary transition while moving to urban areas, which involves the drop in traditional rich fiber meals and promotion of processed foods, has also contributed to insulin resistance, which is the absolute path to diabetes. The third factor is obesity and hypertension. Excess body fat strongly promotes insulin resistance. High blood pressure also makes metabolic health worse, and this predisposes people to type 2 diabetes mellitus. The fourth factor is the aspect of missed screening opportunities, and we talked about this in our previous video. Routine blood sugar monitoring is not prioritized, and this leads to late diagnosis and poor prognosis. According to the Kenya National Guidelines on Diabetes Management, more than 88% of Kenyans have never screened for diabetes, and this really worries me as a person, as a healthcare provider. This is really bad. We need to enhance routine blood sugar monitoring to prevent and minimize complications, because early diagnosis really makes a difference. We also need to enhance awareness and also be aware of the risk factors, because risk factors like positive family history, obesity or overweight, age above 35 years, sedentary lifestyle, history of hypertension or dyslipidemia, history of polycystic ovarian syndrome, hormonal imbalance, urban lifestyle, and pregnancy because of gestational diabetes. If we have any of these factors, then we need to enhance more screening, because this helps in early detection and prevention of complications. So what are some of the prevention strategies for diabetes? The first is regular blood sugar monitoring, and this is the most important one for me. Routine screening is very critical because it can help in early detection and prevention of diabetes complications. If diagnosed at a pre-diabetic phase, there is a valuable opportunity to regain control through proper and targeted lifestyle modification plans, and this will reduce the probability of advancement to full-blown diabetes. The other prevention strategy is public awareness. The first line defense for diabetes has to be proactive public awareness creation and patient education. It will significantly reduce late diagnosis, which is my main problem, and minimize complications. Another prevention strategy is lifestyle modification. This is the golden standard. Lifestyle modification interventions such as healthy diet, physical activity, and weight control are the cornerstone of prevention and management of type 2 diabetes. Studies by the New England Journal of Medicine suggests that 5 to 10% weight reduction and at least 150 minutes of exercise weekly and a healthy diet will reduce progression of diabetes by 58% or more. In my call to action, every late diagnosis of diabetes mellitus will always arouse similar emotions. Could this have been prevented? Well, in many cases, the answer is absolute yes. However, prioritizing early screening, patient education, and sustainable lifestyle modification will control the continuously rising burden of diabetes mellitus. Without implementing such proactive interventions, the productivity, long-term well-being, and survival of our people will remain at significant risk. Once again, if this video gave you clarity, if it challenged how you think about this disease, subscribe now, because this channel is about helping you stay ahead of diabetes and not reacting to it. Share this with someone who hasn't checked their blood sugar in years. You might just change their life, because diabetes doesn't start in the emergency room. It starts silently, and the earlier you look, the more you can change the outcome. Thank you.